Medical assisting is for people who are interested in breaking into the healthcare arena. They like to get into the clinical piece, but there's also administrative and medical assistants who stay out of the clinical piece and move more into the administrative portion of it. So I think it's for those people who want to do more than just a routine job.
So the reason you would venture into a medical assisting course is because you have a desire to work in a clinical setting. There are many opportunities for you to get your basic education here, and then you get into the medical setting, and there's, you can become an office manager, you can become a clinical manager, you can become an RN, you can become an LPN. This is a springboard if you really have a desire to work in a clinical setting and to be in healthcare. There are all kinds of different places that a medical assistant who's been successful and has that basic training can grow into. Or that's something you can do for the rest of your life because you get into a practice and you become acclimated and the patients are your family.
Well, I work at WellStar as my full-time job, and WellStar hires a lot of medical assistants, and we have a huge medical group, so most of our medical assistants work in practices. We have multiple specialties, and so if you're kind of inclined to love kids and you want to work in pediatrics, that's a perfect fit for you. But if you're not the type of person that likes working with kids, then maybe you want to move into something like cardiology. So we have a number of specialties that you can kind of choose from and decide what's your fit. And a lot of times people will try one thing and decide that's just not quite right for them, and they'll move into a different specialty. That's the beauty of being an MA, is you can kind of, feel around until you get that perfect niche for yourself.
Most every physician office in any setting has roles and responsibilities for medical assistants. They may have other staff too, radiology techs or registered nurses, phlebotomists, but the main staffing in especially a primary care or pediatric medical office is medical assistants.
It's important to be passionate about anything that you do. But when you step into healthcare, it's not just a routine arena for work. Patients are coming in and they're literally putting their lives in your hands. And so it's important for you to understand that importance and to grow with that importance and let your career take off. There's absolutely no limit to where you can go.